Well, this summer, most of us will be spending a lot of time outside, so it is a good time to talk about protecting our skin from the UV rays of the sun. And joining us now is Dr. Layla Barrera, a primary care physician at Catholic Health Ambulatory Care in Bayshore. Doctor, thank you so much for joining us. Monsignor and I were just talking about how important this is to constantly remind ourselves of how important it is to protect our skin. So we're coming to you for advice.
Hi, good morning. Thank you for inviting me. So definitely this summertime, especially living in Long Island, it's very important to keep protect your skin. Definitely wearing sunscreen. We definitely recommend that. Wearing light clothes that is covering all areas, long sleeve. We usually recommend to wear wide brim hats just to protect all the areas of the face, as well as sunglasses to protect the eyes. Usually people are not familiar and they think that dark colors don't protect, but usually the dark colors is what we prefer for people to wear for sun protection. Definitely wear cotton and polyester clothes, lightweight, that would be the best. If you're outside, wearing the best way to protect is with different sunscreens. Usually we recommend SPF greater than 30.
So is there a difference? You know, now I'm seeing them all the way up to 70. Is 30 enough?
So usually we recommend, usually at 30, it's proving to protect from both UV light and UVA as well. But the higher the sun protecting factor, the better it is for sunscreen protection.
So what about checking ourselves for what are we looking for? If we're a little worried about, okay, maybe you know something's not right here. What are we looking for?
So usually I recommend people to look at their skin, especially if they're outside, if they work outside, to look at least regularly, at least once a year. We're looking for unusual moles, anything that is suspicion. For example, there's a mnemonic that we use when we're learning medical school, and I usually teach this to my patients too, is the ABCD.
And what is it? What is ABCD?
So ABCD is looking for asymmetry, making sure that, as you can see there, the one half of I usually tell people, imagine it's a mirror, and both sides, they look the same, they match. Make sure that the borders are even and there's no poorly differentiated on the borders of the lesion. Also making sure that the color of the skin is even, or the lesion, I'm sorry. That it is brown or black, that there's not an area where it's brown and then another area where it would be black or tan. Making sure that the diameter is usually when we worry about melanoma, it tends to be greater than 6 millimeters, not always. So we always want to take into account the asymmetry, the border, the color. Most importantly is the evolution, making sure that the lesions are not growing, making sure that the color is not changing. Evolution is one of the critical areas that I usually teach my patients to make sure that they're looking for. Whenever they see a lesion, I tell them make sure that it's not growing, it's not itchy, it's not bleeding. If that happens, I usually tell them to just come and see us.
And finding melanoma in the early stage is extremely critical because you can do what? It is treatable, correct?
Exactly. So melanoma is one of the skin cancers that we worry most. It is one of the deadliest ones. But it is treatable as long as there's early detection. So if there's a family history, I usually tell patients to definitely wear sunscreen, go see the dermatologist. There hasn't been specific guidelines to how often have patients see a dermatologist of primary care just specifically for skin exam. So it is recommended to do regular skin exams. And as a primary care, usually during a physical exam, it is something to do, examine the skin and make sure that you're asking patients to make sure that there's no lesions that they're concerned about.
On your skin, the tone of your skin, are fair skinned people more at risk than people who have darker skin?
Definitely, but I for sunscreen for everyone, regardless of skin color. But yes, you're correct. Light skin are more at risk.
And what about this summer with our children? How young can a child be when you put sunscreen on them?
So they usually recommend for children to wear it less than 6 months. It's not recommended. Recently, there's been a lot of recalls on sunscreens that do have benzene, which is a carcinogen. So I would just look for that. But otherwise, children can also use sunscreen
You
as
know,
long as they're greater than 6
I
months
found
old.
out sort of the hard way last weekend. I'm pretty good with sunscreen now. I was saying at the beginning of the show, when we were young, there really wasn't a lot of stuff out there. Now that there is, but it was a cloudy day. It started out Saturday cloudy, and I feel like I did get a little bit of a burn. I think it's not just on sunny days that we need sunscreen.
No, every day, regardless if it's cloudy, I would still recommend wearing sunscreen.
Okay. Well, doctor, thank you so much for your advice. Have a great summer, and yeah, put the sunscreen on before you leave the house so you can check out every spot and make sure you don't miss anything. Doctor, thank you so much.
Exactly. Take care. Thank you so much.